Welcome Dr. Shetty to Editor's Speak. Sir, is a hospital always liable for harm caused to its hospitalized patients?
The answer to this cannot be in black and white. It will depend on the condition of the patient, the type of the hospital where the patient is admitted, the level of care of the hospital, and the understanding between the relatives and the patient and the hospital. There are certain exceptions to the rule, like a patient in the ICU, the patient in the OT, where the access of the relatives is minimal or restricted. At such time, the hospital is going to be held liable. Hence, the monitoring and the level of care should be of the highest order. As far as the wards go, there are certain aspects of the patient care which are with the relatives. At such times, it will depend on the circumstances and of the case which the case has been filed on.
So this is very interesting. Can you share a real life case that will help us understand what you've just shared?
In a recent judgment from the National Consumer Commission, a elderly patient, 90-year-old, suffering from prostate cancer, was admitted in the ward with bladder infection. The patient had a fall the next day morning. The X-ray was performed, the CT scan was done, CLW suturing was done, the patient was stabilized, and after a few days the patient was discharged with oxygen. The patient passed out a few days at home. The relatives of the patient filed a case of negligence against the hospital. They alleged that the hospital had assured round-the-clock monitoring and not doing so was deficiency of service. The hospital defense stated that the relative of the patient was not around and the patient had fallen down from the cot, getting out on his own, not calling for the assistance of the staff of the hospital who were present round the clock was not their mistake. The court accepted the defense and did not hold the hospital liable.
Sir, what type of hospital was it?
Interestingly, it was a corporate hospital, a multi-speciality, and more interestingly, the court accepted the defense of the hospital and did not hold the hospital liable for fall of the patient from the cot.
Sir, so what would you advise hospitals based on this court's judgment?
See, two specific suggestions. One, the standard of care should be highest in case of infirm and elderly patient. Two, there are certain aspects of the patient care in wards which are looked after by the relative. At such time, the relatives have to be, or the attendants have to be taught or educated about the use of the bed control panels, the call bells, the use of side railing which has to be there, the monitoring the patient. And all this has to be documented and an acknowledgement taken from the patient or the patient's relatives.
Thank you, Dr. Shetty, for your valuable inputs.
Thank you.